As President John Mahama prepares to deliver his second State of the Nation address to Parliament tomorrow, attention is turning to what he promised Ghanaians in the health sector a year ago and how far those commitments have been met. In his previous address, President Mahama painted a picture of a health system under pressure but ripe for reform. Sarah Apenkor has been finding out.
Central to his concerns during his first State of the Nation was the potential 90-day pause and withdrawal of support from the United States Agency for International Development, USAID, describing the move as a critical threat to programs targeting malaria, maternal and child health, nutrition, and HIV/AIDS. At the time, President Mahama called for urgent mitigation measures, including reallocating domestic resources to prevent service disruptions. Disease outbreaks were also high on the president's agenda, referencing a severe cholera outbreak that affected several districts and claimed dozens of lives, as well as a meningitis outbreak in parts of the Upper West region, while announcing the proposed Ghana Medical Trust Fund to support patients battling non-communicable diseases.
The Agenda 111 program, which was started as a knee-jerk reaction during the COVID-19 pandemic, I'm sad to note that there is no dedicated funding source for such a gargantuan project. One of the most pressing issues confronting our health sector today is the USAID's sudden 90-day pause in services without prior notice and the looming threat of complete withdrawal of programs that do not align with the USAID's strategic interests. The impact will be challenging without urgent intervention. I've therefore directed the Minister of Finance to make immediate financial arrangements to mitigate this loss.
However, full implementation and dedicated funding streams are still being closely watched by stakeholders.
We know that there has been some engagement with the national programs on HIV, tuberculosis, and malaria, but from the civil society perspective, we have not had any such engagement. So we are unable to speak to how much has indeed been allocated by governments to show up the differences that the U.S. funding withdrawal has created.
As President Mahama returns to Parliament this Friday, the health sector stands as both a test and a reflection of his broader development agenda, balancing fiscal constraints with expanding access.
Eventually, we are coming to the end of Global Fund support for our country. And what this means is that we need governments more than ever before to ensure that we have more resources domestically to support the health sector, especially with respect to the three diseases, HIV and AIDS, tuberculosis, and malaria.
Observers will be listening closely for updates on funding commitments, program rollouts, and the next steps towards building a stronger, more self-reliant healthcare system.